Hello all, welcome to TCAM Tutor channel. So we will be discussing the next set of previous question which is asked in the MOH. So the first question will see what is the causative organism which is causing peptic ulcer. The most common organism which is causing peptic ulcer is H. pylori, Helicobacter pylori. That is the major reason which is causing peptic ulcer. Peptic ulcer means it is a combination of duodenal ulcer and gastric ulcer. Okay, duodenal ulcer and gastric ulcer, these two togetherly called as peptic ulcer. So the most common reason is H. pylori. So H. pylori, how it is entering through the body means through the contaminated food, contaminated water. Okay, and through that way one person will be getting, and that other person will be giving to other like other people also they will be getting, like person to person contact. Okay, first of all it will be entering through the contaminated food and contaminated water. First one person will be getting and it will be spreading to other people. Okay, it is a contagious condition, this H. pylori. Most of the time this H. pylori is a asymptomatic case. Okay, first of all you don't get any symptoms. So when this H. pylori is entering into the body, first of all they will be creating some inflammatory changes, which means gastritis you will be getting. Most of the time it will be asymptomatic, so patient won't get the symptoms of the gastritis. Then slowly it will be turned into ulcer. That time only most of the people will be coming to know about this condition. Okay, then how you will diagnose with the endoscopy with the biopsy. That is the main investigation for confirming the H. pylori. You will be doing endoscopy, and with the biopsy we can confirm it is a case of H. pylori. Because of that the patient has got peptic ulcer. Okay, so H. pylori, this Helicobacter pylori, what they will do means, first of all they will be releasing one enzyme, urease enzyme they will be releasing. Okay, these enzyme will convert the urea into ammonia and carbon dioxide, and because of the presence of the ammonia, what happened, this H. pylori will be protected from the HCl, because in our stomach HCl is present. No, HCl is a strong acid, it will kill all the organisms, but for protecting from the HCl they will be producing this ammonia, and because of that what happened, H. pylori will easily enters into the gastric mucosa and they will be producing inflammation, and that stage if you are not treating properly, that inflammation will be turned into ulcer formation. Okay, from the ulcer you will be getting bleeding, all those things you will be getting. Okay, and if you're in that ulcer stage also, if you're not treating properly, it leads to the next condition is gastric mucosal associated lymphoid tissue lymphoma, cancerous condition. Okay, gastric mucosal associated lymphoid tissue lymphoma, or otherwise gastric adenocarcinoma. Okay, or otherwise another one complication is this ulcer will be going towards the inside portion. Okay, to the inside portion they will be, this ulcer will be moving and result in the perforation. Okay, perforation, and because of the perforation means you are getting a hole. Okay, so because of the ulcer formation, the ulcer will be going deeper structure, it will create a hole in the abdomen, and because of what happened, whatever the contents are there in the abdomen, the HCl, the other gastric acid enzyme, this will all will enter into the peritoneal cavity, and it will create inflammation in the peritoneum, and you will be getting peritonitis. Okay, so peritonitis is also a complication of peptic ulcer. Okay, so these are the complications you will be getting due to the H. pylori. This is the most common organism which is causing this peptic ulcer. Okay, and the most common site this peptic ulcer is happening in the lesser curvature of the stomach near incisura angularis. This is the part where the most commonly peptic ulcer used to obtained. Okay, next question is Saraka indica used in which condition? Saraka indica is Ashoga. Okay, Ashoga. So Ashoga mainly it is given in the gynecological disorder. So we used to be used this drug in the gynecological disorder. Next one is digitalis purpura. That they are be producing digoxin. Okay, that digoxin is used for the heart medicine. So it is a cardioactive medicine. The next one is stress relieving drug. Okay, which is a stress relieving drug they have asked. So the main stress relieving drug is Withania somnifera, that is ashwagandha. The first one is Bacopa moneri, that is Brahmi. Brahmi is actually used for the improving memory. Then Tinospora cordifolia is Gudji. Okay, so the Withania somnifera is the much more main medicine we can give for the stress relieving. Then another one condition they have asked is opiates production for the pain relief from the brain through the therapy. That is mainly, it is a definition of the acupuncture. Okay, so that is a definition of acupuncture. So in that case, their belief is by doing the needle therapy, opiates are producing, and through that way we can control the pain, all those things. The next one condition is expectorant, which is the expectorant. So the answer is Adathoda vasica. Okay, Adathoda vasica is Vasa. Okay, so Vasa is a best drug for this mucus relieving. Mucus relief. It helps in the relieving of the mucus. Then most common site which is causing chronic gastric ulcer is the lower part of the lower curvature, lesser curvature. Okay, the lower part of the lesser curvature is the most common site where you will be getting the gastric ulcer. Then another one question is vulvar irritation, pruritus, speculum examination reveals hyperemic edematous vaginal vault with odorless discharge. Okay, so they are discussing about the infection is occurred in the vaginal area. So the main thing for identifying this infection is odorless discharge, and severe pruritus also mentioned, so that is indicating candidiasis. If it is bacterial vaginosis, you will be getting fishy odor smell will be there. That was a diagnosing point for the bacterial vaginosis. Fishy odor, green color or off-white type of fluid you will be getting. Okay, so that will be the indication for bacterial vaginosis and Gardnerella vaginalis. Okay, both are associated conditions. In trichomoniasis, you will be getting frothy yellow colored vaginal discharge you will be getting. Okay, if it is trichomoniasis, frothy yellow colored vaginal discharge will be getting in the trichomoniasis. In candidiasis, severe itching sensation, white color, cottage cheese type of discharge you will be getting. Odorless cottage cheese type of discharge will be there. So that's why the answer will be candidiasis will be getting. Then next question was all true about the severe asthma except one feature. So answer is heart rate is less than 60, because in asthma, severe asthma, heart rate is increased. Tachycardia will be there. So that answer is false. The rest of the others you can see in the severe asthma, central cyanosis, because in asthma this airflow is not happening properly, so oxygen supply will be reduces. You will be getting central cyanosis. Then pulsus paradoxus. Pulsus paradoxus means while during the inspiration there is a fall in BP will be happening. Okay, during the inhalation, fall in BP, that is called pulsus paradoxus. So that is also a symptom of severe asthma. Then disturbance of consciousness will be there, because airflow is reduced, oxygen supply is reduced, so you will be getting loss of consciousness. Okay, so such type of poor memory, so such type of symptoms you will be getting. But usually in asthma, increased heart rate will be there. So the answer is heart rate less than 60, that is the false in this condition. Okay, so rest of the questions we'll discuss in the next video.